Hi guys, I'm Dr. Sam over here at Live Your Life Integrated Health and Chiropractic in Erie, and today we're going to talk about some simple things we can start doing for knee pain. So these very first few things I'm going to show you are really basic, but if you aren't able to do them or if they cause pain, we need to be doing them because we need to start strengthening that knee. So the first one, and the first three I'm going to do, you can do sitting up or laying down. I'm going to show them to you sitting up. And what you can do is basically called a simple knee press. We want to keep all of this nice and straight. You can see my ankle is nice and straight. It's not leaning to one side or the other. I'm going to activate the quads, these anterior muscles here, and push that knee down into the ground, okay? So we're just taking those quads, tightening them, and by tightening them, we're gonna see this knee push into the ground. Do that again. And so starting off, we're gonna do about sets of 10, and we're gonna hold each of those for 5 seconds. Hopefully you can get up to doing 2 sets of 10 twice a day, holding each of those for 5 seconds there, okay? If that's too much, you can start with 2 sets of 5, or you can just start with 1 set of 10 and work your way up. Once you're comfortable doing that, that's not causing any irritation, we can take a foam roller, or today we have paper towels, and we are going to place them under the knee, and we're gonna do what's known as a short arc. So basically we're doing fairly similar. We're gonna be contracting that quad, so we want to be squeezing this area here again. We want to create more stability in that area. But now we're lifting that foot off the ground a little bit. That heel's coming off. We're contracted here. Same thing. We're holding these 5 seconds. And we're going to, again, get up to 2 sets a day, holding those each for 5 seconds. So this is the next progression in this line. And once that is comfortable and not irritating, what we can then do is known as basically a straight leg raise, and we don't have to go up very high, just a few inches off the ground. But same thing, really focusing on contracting here. Then we're gonna lift this leg up a few inches and relax, and we'll really contract, lift that leg up a few inches and relax, okay? A lot of times what we see is when people are doing this lift, they stop doing a good job of contracting the quad. You can see how my knee's just slightly bent. We want to make sure that quad is contracted. That's the whole point of this exercise. So we always want to really be thinking about this area here. All right. So 2 of the other things we can start doing once those come easily to you and they're not causing any aggravation, we are going to come over to the wall here. We're going to place our butt against it in a slight squat. And this is going to put some shear pressure into there, which will help stretch that and strengthen it. And one of the things that we see with patients a lot, especially patients that are having knee pain, a lot of times it happens because of weak glutes as well, is we'll see these start coming in, okay? So these knees are not turned out, they're not over the feet, they're flopping in this way. We want to activate the glutes in this position, and we want to hold those knees out. We're working up to doing this twice a day for 1 to 2 minutes, but we don't have to start there, okay? Even if you just do this position for 10 to 15 seconds, that's going to start strengthening that area and stretching that out a little bit, okay? So again, the most important thing here is making sure those knees stay turned out, not letting them fall in. And the final thing that we're going to do is stability. So we're gonna do just a single leg stand. Now you can be next to a wall if you need to be able to grab onto something or you're worried about losing your balance. That is absolutely fine. Or even if you need to just hold on while you're doing this. All this is lifting one leg off the ground and putting that weight onto this other leg. But that's going to start strengthening all those different muscles. It's going to give us a sense of balance, and when we're able to, we're going to start taking that hand away. All right, so this one, we're working up to fairly the same thing as the other, about 2 times a day for 1 to 2 minutes, being able to hold that position. All right, you guys. So that is for knee pain, and same thing like all these other joints we've talked about. When we're working on knee pain, we don't want to just be working at the knee. We want to be working at the hip and the ankle as well. So you can check out our hip or ankle videos for more advice on that. Thank you guys.